The message so far is obviously quite clear. Americans are going to need boosters. But what's magic about 8 months?
Good evening, Carl. That's the million-dollar question right now. It doesn't really make sense. The guidance on boosters, we've long known that if you're immunocompromised, you just said it, if cancer, recent chemotherapy, solid organ transplant patients, they will likely need a booster. They're going to be first in line. If you're over 65, you'll be second in line. That makes sense because that paradigm applies to other vaccines, other boosters that we take. However, for those that are otherwise healthy, less than 65 years of age, these vaccines, 2 doses of Pfizer or 2 doses of Moderna, remain powerfully effective at keeping people out of the hospital. So to issue this broad guidance here that everybody's going to need a booster at 8 months, we're going to phase it in like we phased in the initial doses, does not align with the data as we know it to be right now. And this will cause potentially confusion. It's going to cause people who've been fully vaccinated to say, wait a minute, I thought I was protected. And crucially, Carl, for those that are unvaccinated, it's going to cause them to say, well, are the vaccines working or not? That's what I hear constantly from those who have questions about the vaccine and are waiting and seeing. Why aren't 2 enough? We don't have the data to say that 2 are not enough.
Another layer of confusion may come from those who received the J&J single-dose vaccine. What are they supposed to think tonight?
Well, we haven't done enough talking about those specific individuals. And it's been my belief, based on data that we have on J&J's sister vaccine, AstraZeneca, that individuals, the 13 million who received 1 shot of J&J, should be entitled to a second shot of Pfizer and Moderna, that mRNA booster now. We think it's safe and effective based on, again, that surrogate data. And yet, J&J is going to be publishing data in the next few weeks about what 2 doses of a J&J vaccine separated by, say, 6 to 8 weeks, what that means for people. So for all of you out there that are waiting for that second dose of a vaccine, you will have it if you got that 1 dose of J&J, but it's likely going to be another dose of J&J.
Meanwhile, tonight, the governor of Texas, Greg Abbott, who has banned mandates for masks and vaccines, tested positive today. His office says he is fully vaccinated. He's in good health. He's not experiencing any symptoms so far. And sources have told NBC News, at least, that the governor told people he also had received a booster. He's going to get the Regeneron antibody treatment. And I'm wondering, can you break down not just the effectiveness of the boosters, but where this antibody treatment sort of plays a role here?
Well, Carl, it's interesting that the governor would be high risk based on his age, his medical history. I'm not privy to necessarily, but if you were to have a high risk condition like diabetes, for example, that would add further to his risk profile. But because of his age, he's considered high risk. And what we do know is that the indications for these monoclonal antibodies have expanded since President Trump received it about a year ago. And so this is very much in line with he's been exposed. Now he's tested positive. To prevent any progression of disease, let's give him this cocktail. And we think that's going to be effective at reducing any chance of a complication. Zooming back, this is an opportunity for Governor Abbott to really pivot on messaging on the vaccine, to double down and say to everybody who's unvaccinated in Texas, it's a large proportion of his state, that look what happened. I'm not experiencing any symptoms. I'm fully vaccinated. But if I wasn't fully vaccinated, this would be a very different story. He can lead on this issue by example.
Finally, there's the ongoing tug of war of dosing Americans versus dosing the rest of the world. And you've said it's important to get doses out to the rest of the world, maybe before Americans get a 3rd dose. Can you explain that?
This notion of giving the same people more vaccines, again, those that are not high risk, more vaccines, is not going to keep us safer. An America First strategy with vaccines should actually be to try to vaccinate as much of the world as possible so that we can protect as many people as possible and mitigate the chance of a variant arising that will render all the existing vaccines useless. That's an America First approach that will keep us as safe as possible. Giving more vaccine to people who do not necessarily need it, given the data today, makes no sense, and it's not going to save lives. It's actually not going to protect us and end this pandemic any more quickly.
Dr. Vin Gupta, good guidance, and I appreciate that very much.